Hi, this is Sakib Rahman from the Orthoclips podcast series. And today I'm with Dr. Jeffrey Gum, who's an adult and pediatric spine surgeon at the Norton Leatherman Spine Center. And he's also assistant professor at the University of Louisville Department of Orthopaedic Surgery. And today we're going to be talking about why orthopedic trainees are not selecting the right job after training. Thanks, Dr. Gum, for coming on the show. Appreciate it.
Thank you. Thanks for the opportunity.
Perfect. Let's get into it. So I had seen your investigation in the AOS Now, I believe, recently, obviously of pertinence to our resident and fellow listeners. So what's the problem that your group identified? Like, what was the perceived issue, or background situation that prompted your study, and what your result, did your results confirm that or not?
Yeah, so great question. So it actually all started when I was finishing my fellowship about 6 or 7 years ago, looking at jobs. And what I realized very quickly is when I was sorting through contracts and paperwork that I had little to no business training with regards to what I was about to step into. I was entering a practice that I was pretty familiar with, and there's some benefits from the hospital side to where we were hospital employees, and I wasn't running a true business, but I was still entering a business type environment that I felt like I was not prepared at all. So I started discussions with our group and reached out to a bunch of past fellows and found that for the most part, the face-to-face discussion led me to believe that we were not doing a very good job training our fellows. And what was even more alarming, that 2 to 4, we take 4 to 5 fellows a year, but at least 2, if not 3 of those fellows each year were switching jobs pretty quick. And so to me, those couple details pointed to the fact that we were not doing a good job preparing our trainees for the workforce. And so we decided to set up a survey or a study to look into that and try to dive a little deeper to see what the rationale behind that was.
Okay. And what did you find?
So we surveyed, we utilized the Academy email list or database, and we surveyed them. And as any other typical survey study, the response rate wasn't super high, but we ultimately had about 350 respondents, and they said that their rationale for choosing practice was location, practice type, and family proximity. And all of that makes sense. If you talk to trainees or fellows, the stats that I'd heard prior to doing the study was the majority of them stay within about 100 to 150 mile radius of where they finish their training. And there's a lot of factors that go into that. We did find what we suspected, that there was a pretty high rate of attrition or job switching. And we found at least 50% of those trainees switched jobs in a kind of 2 to 5 year span after they took their job. So, the overall arching theme here was, orthopedic trainees for the most part have not failed that much in their life. If you look at the application candidates that come through and interested in orthopedics, the scores are through the roof, their grades are great, they're involved in everything, they're doing research, they're top trainees or top students coming out of medical school, but yet 50% or more fail at picking the right job. And so that just didn't make sense to us. And so the reasons they cited for leaving were financial reasons, and the practice was not advertised. And one of the flaws in a survey type study is it's hard to get some of the granularity that's when you talk face to face. And so to me, when the study confirms what kind of proves our hypothesis, but when you start to talk to fellows, which I do now on a very regular basis about job selection, one thing that wasn't really captured in the study was people don't look ahead at the kind of 5 and 10 year plan or outlook. Instead, by the time we finish training, a lot of us are in our 30s, if not later, and we've accumulated a massive amount of debt. And so that initial dollar figure on what that first contract is, and what those first couple of years, I feel like folks place too much emphasis on that And the other part of it, they don't understand the detriment to switching, right? I've had a couple of fellows over these past 4 or 5 years where they're like, well, I'll just take this job that pays more and stick it out for a couple of years and switch. And the downfall to that they don't understand is the indirect cost of moving your family or kids to a new school system, buying and selling a house, and even the referral base. For you to be successful in practice, most of us know that you need some sort of referral base in the majority of settings. And to not put energy into that or marketing and then just scrap it and go somewhere else 2 years, there's a lot of indirect cost in that. And so we found a lot of interesting things out of the study, but it was not granular enough to tease out some of the wrong decision making process with regards to choosing that first job.
Yeah, I guess in addition to those indirect costs, I think one of the things people don't think about, and I understand the motivation. I mean, you have a lot of debts. You sort of weigh it. You say, yeah, moving again is not great, but I really gotta sort of make some money out of the gate to get under this mountain of debt, for instance.
Yeah.
And it's a sacrifice sometimes people are willing to make. I'll do this and then I'll move. But there's another factor, which is sometimes if you start to make a couple, you make one move, that's one thing, but if you kind of go into a position thinking like, all right, I might have to move, and then you do move, and now you sort of are, maybe you move again. Now you've kind of been moving around, and sometimes that can call into, then when next time you're now looking for a job, people start to call into questions sometimes like, okay, is it the job? Is it the surgeon? You start to wonder, and even I've even heard cases of medical boards having sometimes issues. That's not a major thing, but certainly I think when you're interviewing for a job and you're in your fourth job, people start to wonder, is that a problem with you or a problem with the job? So, kind of already making that very first move right out the bat after 2 years already, you're potentially heading in that path.
Exactly. I've seen a few of the fellows that had all great intentions, and as we know, going through this process and studying it, there's things that come up, and even if you spend your time and study it and pick the job based on the right decision, there's still things that are unforeseen. So to add multiple moves in that, if we're interviewing somebody for our group and somebody's moved 4 times in 3 years, that's a massive red flag. So that's a really good point that fits into all this really well. The other part of it that, again, it's a little hard to tease out, but because I give lectures on this and teach quite a bit, and a very important topic to me personally is the job landscape. So if you look at our training pathway, the majority of us end our training in some sort of an academic environment, right? And that's just the nature of our training. And so we understand the academic setup, right? And even if you're not truly interested in academics, but you have some, maybe a little bit of interest, there's a lot of folks that are gravitating to those setups because that's what they've seen, that's what they're familiar with. And once they get into that role as an attending, they realize that, research and a lot of that other time, that's almost like a hobby, right? Depending on your pay structure. And they realize when it's consuming a lot more of their time or family time and isn't something that they were truly passionate about to start with, then they figure out academics isn't for them. And so there's a lot of our fellows that say they're interested in academics. When they start, they land at an academic job, and about a year or two in, they looking at themselves in the mirror and say, I'm interested in my friend that's, in a more business, I hate to use savvy, but more business-like environment. And so that was another reason why we were seeing a lot of folks switch jobs pretty quickly.
Yeah. What do you suggest as the right way to go about it, or maybe a solution to avoiding this problem of not selecting the right job after training?
So I think the external eye, the easy thing is as well, we need to embed X, we need to embed business training. or business courses within residency. And we all know, with especially the implementation of work hour restrictions and things like that, that it's in at least in an orthopedic track of 5 years is jam packed already of of didactics and surgical training, and we're trying to teach them how to operate as best they can and take care of patients. That introducing a formal track for education is not realistic. I mean, there's not much time to squeeze more in. So you can do that. I think that augments the training and perspective that our trainees get. But the biggest thing that we found that I think is a solution is kind of breaking down that barrier. You know, if that medical student asks the attending what they make for a living and what their salary is and how they picked a job, that's almost taboo, right? And similar to residents, not as much because they're closer from a training perspective and somewhat for fellows. But in my mind, breaking down that barrier and making some of those questions and comments and discussions not taboo, to where I'm open with my fellows of, you know, what contracts look like, what my first salary was, what my current salary is, and how I set up my practice and why I see certain types of pathology in patients. And so the first step, I think, is breaking down the barriers to that discussion for the business side of medicine. And, you know, when we do it now, when I have discussions with my fellows, they absorb, I mean, their eyes light up and they absorb it like a sponge. So that's the first step, I think. And then second, trying to introduce some sort of formal didactic session that's, you know, almost in the evening over cocktail and dinner, to where it's a more of a discussion platform than a lecture.
Okay. So can you give me an example? Maybe you can think of an example. I don't know, you have to use names or practices or anything like that.
Yeah.
But maybe just give us a picture that somebody can relate to, one or two examples maybe of that you feel worked out and the trainee kind of made all the right priorities and took the right steps to avoid those pitfalls and, you know, head down a path that avoided, you know, these problems.
Yeah, so our fellowship at Leatherman Spine Center over the past, really since I got interested in this, I have another partner, Mitch Campbell, who's pretty passionate about the topic as well. We set up a formal didactic series to where once a month topics that are on how to evaluate jobs, how to negotiate contracts, what to look for in the right job, how to position yourself good in the application process. And so that formal didactic session has spun into not just the lectures, but it sparks conversation of the fellows, right? And we see right after the first one of the year that we do the first month they're here, they're starting to pick the attendings' brains in a lot more detail than what we saw prior to initiating that. So I think that's a good start because, you know, it's an hour a month, hour and a half a month. And what it's done is it's made the fellows really critically evaluate it. The other thing is we see them sharing information with each other about the job landscape a lot more. And so, you know, even somebody that's only 5 years into practice, I understand the job landscape more than my partner that's been in the same group for 25 years, right? So I understand some of the business opportunities with surgery centers and other ancillary type stuff, but that evolves so rapidly that even being 5 years distant from the job market, the fellows now are absorbing more of that. So we really create an environment to share what's out there and promote the fellows to critically think. And what we found is the fellows choosing jobs. So since we started to do this, we're seeing one, if not zero a year, switch jobs. And so I think that process of sounding it out with your peers, sounding out with your attendings, and to me, the part that I always preach to them is look at where people are at 5 and 10 years and what are your long-term goals. Do not look at that first year paycheck or second year paycheck, because that's not a good reflection of if you're going to be happy in 20 years at that job or not.
Okay. I guess last thing, any remaining tips or resources perhaps, other than your good words of advice and your your article I saw written up. Any other resources you might want to point residents to that they could kind of, look up or pull up
Yeah,
to help them out?
yeah. Um, more so, this is more of kind of a word of mouth resource, but it's at least in the spine world, we've found that industry partners are very helpful in this. Um, like I said, it's hard to have a formal didactic session that gets embedded into a orthopedic residency program, and so the what I've really seen is there's been an almost exponential uptick in the type of courses industry offers, right? So we've all been to cadaver courses, we've all been to courses where we learn how to improve on X technique, but there appears to be a lot more business oriented courses. And come my fourth year and chief year of orthopedic residency, those courses were the ones where the light bulb started to go off, and I really needed to start to think about some of the business aspects. And so I would urge our trainees to utilize your industry partners to help with some of that selection process and some of the basic business education, because I think it could be beneficial.
Okay, great stuff. I think that's about it for time. I want to thank my guest again, Dr. Jeffrey Gum. We've had a discussion today talking about why orthopedic trainees are not selecting the right job after training. A lot of really useful information for the residents and especially fellows out there. Dr. Gum, I want to thank you again for coming on the show. I really enjoyed it.
Yeah, thank you, and happy to answer future questions if folks are interested in the topic. Thanks for the opportunity.
Great, thanks.